This year, we presented an abstract on the secondary quality of life domains that we were able to study in the KarMMa study. So this is the KarMMa-1 study, the phase 2 pivotal KarMMa trial to determine the efficacy of BB2121, now known as Ide-cel, in relapsed refractory multiple myeloma patients. As everyone knows, that trial was positive, showing overall response rate greater than 70% and actually greater than 80% in their 450 dose, which is the dose they're going forward to the FDA. What was interesting about this is that there were a lot of quality of life questionnaires, and the patients were actually very compliant in filling them out. And at EHA, the primary quality of life domains were presented, and those looked to be improving with CAR T-cell. In this abstract, we presented the secondary quality of life domains as well as index of well-being by another scale. And with these measures, we were able to see, one, that in general, patients with relapsed refractory myeloma have lower secondary quality of life measures or values as they get on the study, meaning that they feel less good than the average population, which we are not surprised to see. But very interesting, on subscales such as social and emotional functioning and general image and general sense of well-being, they were all able to improve in this regard through their CAR T-cell treatment. And particularly at the 9-month mark, you could see some general differences in the groups at the 0 versus 9 months in how the patient population had improved in these quality of life measures. What this means is that for a treatment that is so effective, we are not giving up anything for quality of life. And actually, we may be improving quality of life, which is a huge deal, because if you think about it, these therapies are going to be very expensive and they're not yet curative. But if there's an added benefit, not only to number of months lived and number of months lived without disease, but also quality of life, then I think it's really worth spending the money to give these patients that opportunity. I will point out that Ide-cel is a one-time treatment, and so these patients get their CAR T, and after their acute recovery, they go home, they don't get any more chemo. So this is something that we think is probably helping quality of life. Ultimately, this type of data, I don't think will necessarily change whether you use one CAR T-cell or another, because other CAR T-cells are also showing some pretty good quality of life data. I think it's going to help us decide between CAR T and another modality, for example, chemotherapy or bispecifics or something that isn't a one-time treatment.